Hey folks, Dr. Shawn Baker here. Let's talk a little bit about heart disease and where the sort of belief that cholesterol and saturated fat is what's leading to heart disease. So let's go back to the very beginnings of this. And so we're going to talk about what does saturated fat and cholesterol do in our body, besides give us quote unquote heart disease, but why do we have it in the first place? Is there any use for this? There was a researcher many people know by the name of Ancel Keys. Now his story goes back to the 1930s when he received his PhD in oceanography and biology from UC Berkeley. Now he studied fish physiology for about 6 years before then going on to earn a PhD in human physiology. Now during World War II, he worked for the Cracker Jack Company. And as part of his efforts, he developed something called K rations, which consisted of hard biscuits, dry sausage, a hard candy, and chocolate, and this provided 3,200 calories of basically nutrient-poor calories for our soldiers during World War II. But what really set him off is back in 1955 when he presented his hypothesis around diet, lipids, and heart disease. And so the theory was made that dietary fats and cholesterol drove the rate of heart disease. Now, to back up this claim, he pursued something which was famously called the 7 countries study. Now, in this particular study, Keyes studied the relevant diets of these people in different countries and then compared their overall intake of cholesterol, saturated fat, and compared it to the rates of heart disease. Now, what he claimed to find was that those people with very low fat, low meat, low cholesterol diets had a lower chance of heart disease, and this became known as the lipid hypothesis. Now, the lipid hypothesis was composed of 2 parts. Number one was that dietary saturated fats raise serum blood cholesterol. The second thought was that elevated serum blood cholesterol would then go on to lead to atherosclerosis and subsequently heart disease. The truth was that the 7 nation studies, he kind of cherry-picked the nations. So he included Greece, Italy, South Africa, Japan, Finland, and the United States, and used that data to fit his hypothesis. Now, he had actually had data on 22 studies seen in this chart here, which he did not highlight. And when we look at all 22 studies, we see that those relationships basically fall apart. In fact, countries like the Netherlands and Sweden, which had very low rates of heart disease despite eating large amounts of saturated fat, which their diet contained plenty of saturated cholesterol from cheese, eggs, fish, and even chocolate. And so by omitting these countries, he was able to convince people that, again, he had found a consistent relationship. Also, observations he made, he went to the island of Crete to observe what people were eating. Now, he went during Lent when everybody was traditionally omitting meat from the diet due to religious restrictions. And so he had a skewed perception of what the diet actually was. You have to be mindful of what they were eating over a lifetime and not just during one select period like Ancel Keys did here. So this is what kind of shaped that modern belief. And then, people have gone from there to continue to make these claims that dietary cholesterol, saturated fat is driving heart disease. And so is that actually true? Well, first of all, let's talk about what cholesterol does. I mean, cholesterol is not only good for our health, it's essential for human life. Some of the things that cholesterol does in the body, it creates the outer layer of every single cell membrane in your body. Every single cell in your body is dependent upon cholesterol. It strengthens your white blood cells. Has a function in the immune system. It helps us to make vitamin D. It helps us to make our adrenal hormones. It makes bile. It makes nerve and brain tissue. In fact, the brain is composed of 20% cholesterol. Now, beyond its physiological functions, cholesterol plays a significant role in overall mood and quality of life. Low cholesterol levels have been associated with increased suicidality, as well as increased chances of violent behavior. This indicates that these mental problems are potentially a symptom of deficiencies of cholesterol. Now, you can prevent this by eating plenty of dietary cholesterol, which is found in eggs, shellfish, and red meat. Okay, so number 2, this is a thought that a low-fat diet is the best way to prevent cardiovascular disease. Now, again, the problem with this approach is that a low-fat diet has been associated with mood disorders, and according to research, ironically, doesn't positively alter serum cholesterol levels or prevent heart disease on its own. Research shows that a low-carb, high-fat diet is actually better than a low-fat diet for preventing cardiovascular disease. Number 3, this is a big one. Replace all your saturated fat or most of your saturated fat with polyunsaturated fats, things like vegetable oils, for better heart health. Again, saturated fats are some of the most durable fats available. We've been eating them literally for millions of years. Researchers have recently observed that there is a lack of true and thorough evidence for saturated fats' connection to cardiovascular disease. What's more, emerging research is showing that saturated fat is not associated with increased risk of heart disease at all. Polyunsaturated fats, on the other hand, predominantly made of omega-6 fats, which are easily oxidized at room temperature and highly inflammatory when consumed. Research shows that these fatty acids directly contribute to coronary artery disease, atherosclerosis, and cardiovascular disease. Okay, claim number 4. Vegans have a lower chance of getting cardiovascular disease. Again, this is not, once again, not unfounded. Vegan diets, like any diet, can vary drastically in their quality. Oreos are vegan. Pints of Ben & Jerry's ice cream are vegan. Peanut butter can be vegan. Research has shown that just eating a vegan diet, excluding meat from the diet or animal products, does not protect you from cardiovascular disease, especially if the diet is full of hyper-processed foods, sodas, and things like that. So more importantly, it's the diet quality, regardless if you're eating a plant-based diet, an omnivorous diet. And by definition, a carnivore diet is generally very high quality. There's not much room at all for hyper-processed foods. So really, it's elimination of these hyper-processed foods. The last one is all you got to do is change your diet and it'll protect you from cardiovascular disease. Now, that is certainly one factor, but there are multiple things that can drive cardiovascular disease. One is, things like pollution, living in a polluted environment, hyper-processed food, which we mentioned, a lack of movement, so being sedentary, a lack of sunshine, chronically elevated blood sugars, alcohol consumption, smoking, a lack of community, insulin resistance, all of which can damage the arterial wall, which leads to scarring, plaque buildup, and then eventually cardiovascular events. Okay, so again, this is something that's not as clear-cut as it was once believed. It defies common sense to think that something we've been eating as a species for a very, very long time, perhaps even millions of years, is now driving this epidemic of chronic disease. It's more likely that the modern diet and all its hyper-processed food is actually the culprit here. And so cutting that stuff out will greatly, greatly improve your overall health. There are many factors that go to heart disease, and whether we have serum cholesterol or not as part of that equation, it is one of many, many factors. Newly emerging research is going to suggest that in some cases, elevated cholesterol may not increase the risk for cardiovascular disease at all. And again, that's not everybody, but certainly in some instances. And so we'll see what time shows. Anyway, thank you guys for watching. Don't forget to like, subscribe, share it with somebody you think might benefit from this. Don't forget to ring the notification bell so you'll be notified when we put out new videos. We'll see you on the next one. Take care, guys.